Welcome to Policy Exchange. My name's Dean Godson. I have the pleasure of being your host at today's event for the launch of Double Vision, a roadmap to double medical school places, jointly produced by Policy Exchange's Health and Education units. We're obviously at Policy Exchange, we're keen to champion good ideas and solutions wherever they come from. We're proud to have welcomed every Prime Minister from and including Gordon Brown onwards to Policy Exchange, and today we're delighted as the most influential think tank in Westminster to have us today the Shadow Health Secretary Wes Streeting MP for the first time on our platform. Thank you for coming today. Everyone of course agrees that the UK needs more doctors. The case for expansion is, as we all know, both moral and economic. We know that there are growing global shortages of medical staff. At the same time, investing in our domestic pipeline makes financial sense. Thousands of students are rejected from medical schools every year. Last year, more people applied to medicine and dentistry courses than ever before. The absence of these medical schools in some parts of the UK, meanwhile, may be a contributory factor in limiting opportunities to those from lower socio-economic backgrounds who remain still underrepresented on medical courses, limiting attempts to widen that participation. Expanding the number of medical school places will be an important factor in addressing the workforce and future clinical service challenges facing the NHS and to boosting opportunities across the country. The question, therefore, is no longer why should medical school places be expanded, but rather how can it best be done? Policy Exchange's new report, set before you all here today, Double Vision, sets out our own view of how to double medical school places over the coming decade to enable 15,000 medical students a year to enrol on courses in England by 2029. As I said earlier, it's authored by Sean Phillips, our new Head of Health and Social Care, and Ian Mansfield, our Director of Research and Head of Education, and the report sets out how this can be achieved through the concerted effort of universities, government, NHS, professional bodies, and the medical profession itself. To double the numbers, which means creating an additional 7,500 places, will now require imagination, innovation, and boldness. So this paper focuses on 7 critical pathways to achieving this ambitious but still achievable goal. They are: 1, to expand existing medical schools; 2, to open new schools; 3, to diversify the talent pool; 4, to adapt curricula and enable new course structures; 5, to optimise the teaching workforce; 6, to deliver more clinical placements; and 7, to secure the funding to make all of this happen. Shadow Secretary of State, we thank you for joining us today and for championing this important cause. Look forward to hearing what you have to say. We'll then, after your remarks, throw it open for questions. Usual House rules, no question too outrageous. You just have to state your name and organisation first. Thank you very much.
Thank you.
Thank you. Thank you very much.
Well, thank you very much for that introduction, and thank you for braving the very cold weather to join us on a frosty Friday morning. It's a pleasure to be here to round off what has been an eventful week for the debate about the future of our NHS, and some of my comments in the last week have certainly set the cat among the pigeons and led to some kind words from unexpected sources. The Sunday Telegraph editorial last weekend said my interview in their paper sounds a strikingly reformist note. Ian Martin wrote in the Times yesterday, Streeting leads where the Tories must follow. And then came the endorsement last night that no one asked for and nobody wanted. And I quote, "I was actually very impressed by Wes Streeting." So thanks for that, Jacob Rees-Mogg. And so with that endorsement in mind, it's great to be here at Policy Exchange, the perfect venue to rebuild my street cred with my comrades on the left. But of course, there's a serious point here, which is I'm not simply talking to them, and actually I'm more interested in talking to and for the whole country. So I was delighted when Policy Exchange got in touch after our party conference and offered to write a report about how we could deliver our bold and ambitious NHS workforce plan. And it certainly delivers, I think, a whole series of really practical recommendations that we are now looking very seriously at as we produce more detailed plans, as we think carefully about the submission we want to make to the Department of Health and Social Care and NHS England ahead of the election, so that we can hit the ground running on day one of a Labour government. And that was a big part of our motivation for announcing a big pledge on workforce so far out from a general election that's still, I think, likely to be in a couple of years' time. We wanted to give universities and the NHS time to really plan and prepare so that they are also ready for the prospect of a Labour government. And I was really pleased that a centre-right think tank wanted to do this work, partly because it underlines the credibility of Labour's plan, but also because the NHS isn't just Labour's greatest achievement, it is Britain's greatest achievement. And Conservative voters rely on the NHS just as Labour voters do. David Cameron has spoken movingly about the care his family received from the NHS to care for his severely disabled son. As he said, and I quote, "When your family relies on the NHS all the time, day after day, night after night, you know how precious it is." Theresa May has spoken about her reliance on the NHS as a diabetic. She said she was only able to get on with her life and her job in spite of her diabetes because of her GP, her consultants, and most of all, the clinical nurse specialists from her local hospital. And of course, the NHS saved Boris Johnson's life when he contracted COVID in the very early months of the pandemic. Those who can afford to pay may choose to go private, but if the wealthiest man in Britain is hit by a car today, he will wake up in an NHS hospital. And while I may disagree with each of those Prime Minister's policies, indeed, their choices have contributed to the biggest crisis in the NHS's history, when it comes to our reliance on the NHS to be there for us when we need it, to quote another Conservative, we are all in this together. All of our society does better when the NHS is treating patients well and on time, and when the NHS is failing patients, as it too often is today, it hurts us all. Before I move on, I want to address what happened yesterday, the first time in over 100 years that nurses have walked out on strike. This has meant cancelled operations, cancelled appointments, further delays to patients' care when they were waiting too long already. This is the cost of Rishi Sunak and Steve Barclay's decision not to even try to reach an agreement with the nurses. Never forget that they could have stopped this, but they chose not to. These were Rishi Sunak and Steve Barclay's strikes. The government must not sit back and allow yet more strikes to go ahead. Patients are already waiting too long for treatment. Strikes are the last thing that patients need. The government should take up the union's offer, get round the table, negotiate, and in the words of the Daily Express, stop this madness. These strikes are not only the result of the Conservatives crashing the economy or their failure to take up the reasonable offer from the RCN and Unison. They are the result of 12 years of failure to get our economy growing, 12 years of pay freezes and cuts. That's why there wasn't a single national strike in the NHS during 13 years of the last Labour government. We grew the economy so that we were able to cut NHS waiting lists and deliver fair pay for NHS staff. Until we get growth back in our economy, we will be here again and again with more chaos and disruption. Today, the health of our economy is being dragged down by the weight of 7 million patients on an NHS waiting list. Now, I served on the Treasury Select Committee for 4 years, and I can't remember the Bank of England Monetary Policy Committee ever blaming poor growth on NHS waiting lists until it did this summer. Half of those waiting for treatment are of working age. That's 3.5 million people being held back from living their lives to the full. That's the cost of an NHS that is not delivering the standards of care that patients deserve. Manual workers in their 50s having to quit their jobs because they can't stand the pain. Young people still bearing the scars of lockdown without any mental health support, held back from beginning their careers. Meanwhile, middle-aged people are having to leave the workplace to care for their parents while they wait for social care. And this is where I think our thinking in the Labour Party may part ways with policy exchange. In the Labour Party, we have always believed that the economy grows from the ground up and the middle out, not top down. Strong public services don't just have value to the individuals who rely on them, they benefit our nation as a whole. You cannot build a healthy economy without a healthy society. That's why the plan we announced at our conference and that Policy Exchange are launching their report on today is so necessary. Without the people to staff it, there is no NHS. But we are losing midwives faster than we can recruit them. There are 4,600 fewer GPs today than there were a decade ago, and there have never been more vacancies in the health service than there are today. So there is no greater symbol of the short-termism of this government than its decision this summer to cut 3,000 medical school places. They turned away thousands more straight A students in England from training to become doctors at the moment when we needed them most. And we are left in the ludicrous situation where Brunel University has opened a medical school with not a single British student on its books. At the same time, the Home Secretary says she wants to bring down immigration to the tens of thousands. We either need to train more homegrown talent to provide the NHS with the doctors and nurses it needs, as Labour is proposing, or we need to recruit more staff from countries that already have desperate shortages of medics, as this government is doing. But it is clear from their statements on immigration and their actions on health that this Conservative government has no coherent idea what it wants to do anymore. As Keir said this week, what is the point in them? Labour is clear where we stand. We will use spare capacity in the private sector to bring down NHS waiting lists, but we will also fix the root cause of this crisis in the NHS and train the staff it needs. 7,500 more doctors a year by doubling medical school places, 10,000 more nurses and midwives every year too. The biggest expansion of medical training in the history of the NHS, paid for by abolishing the non-dom tax status. So I'm really pleased to have this serious piece of work showing that it is possible and how we might achieve it. I look forward to discussing the conclusions further and working from this roadmap produced by Policy Exchange. And it is not only the Conservatives' closest think tank calling on the government to adopt Labour's policy of doubling medical training places, so did Jeremy Hunt. When we announced this policy at our conference, he called on Liz Truss to nick it, on the basis that the smartest governments always nick the best ideas of their opponents. So, Dean, I'm counting on you now. If you can persuade Rishi Sunak while I work on Steve Barclay, I'm sure that we can get Jeremy Hunt to get us there. And that will give the next Labour government a 2-year head start. So I would be cheering them from the rooftops if they were to steal our policy. But I know we have to go further. This week's report from the IFS couldn't have made the case for reform clearer. The NHS has more money, but we're seeing fewer emergency admissions, fewer outpatient appointments, and fewer elective and maternity admissions than in 2019. We're paying more, but getting less. This report should be a wake-up call. Anyone who has visited a hospital and spoken to staff recently will know that this is not due to a lack of effort. They are slogging their guts out, working as hard as they can. But we cannot continue pouring money into a 20th century model of care that delivers late diagnosis and more expensive treatment. The way our NHS works must change and modernise so it focuses on prevention, early intervention, better use of technology, and faster, more effective treatment. We have to shift the focus of healthcare out of the hospital and into community settings, providing better care for the patient and better value for the taxpayer. This was true before the Conservatives crashed the economy, but there is no option now but for reform to do more of the heavy lifting in fixing the NHS. We will be spelling out more of how our 10-year plan for change and modernisation will achieve this in the new year. I know this will take time, and I want to be ready to go straight after the next election. We've already set out the beginnings of our plan, doubling the number of district nurses qualifying each year, so patients can be cared for in the comfort of their own home. 5,000 new health visitors, so children from backgrounds like mine have a healthy start to life. Mental health support in every school to help young people still dealing with the mental health scars of lockdown. Fair pay, terms and conditions for care workers, stopping the exodus of carers to work at places like Amazon so care can be provided to all who need it. And as we shift the focus away from acute and towards more neglected areas of primary care, social care, community care and mental health, we will need to think carefully about the mix of speciality training pathways medical graduates pursue over the next 2 decades. we are committed to establishing an independent workforce body which will be responsible for undertaking detailed workforce projections and ensuring our workforce is equipped for the challenge of an ageing population and the opportunity of innovative technologies. As you might expect, our pledge to reform the health service has not been universally popular. In an email to its supporters about the dangers to the NHS, Momentum wrote, "The Tories want to privatise it, and Labour's Shadow Health Secretary has even talked about the need for reform." Well, Labour has changed. Keir Starmer has set Labour firmly in the centre ground, once again the political wing of the British people, and that makes my role clear, to be the patient's shop steward. It is plain for anyone who uses the NHS that it is failing patients on a daily basis. So yes, we are going to reform it and make the NHS fit for the future. And ironically, it's those voices from the left who oppose reform who prove themselves to be the true conservatives. So perhaps we ought to get Momentum on this platform to speak next. We will put patients first, even where that means we come into disagreement with organisations like the BMA. I'm not going to try and artificially prolong that particular row today, but let me explain where I was coming from and how the row came about. When Labour announced that we would double the number of medical school places, the BMA criticised it. Why? Because at the same time we said that patients should be able to easily book appointments to see the doctor they want in the manner they choose, whether that's face-to-face, over the phone or online. When Labour criticised the Conservatives for the fact that millions of patients each month can't get a GP appointment when they try to, the BMA said we were demonising GPs. So I'm not going to pretend that the NHS is the envy of the world or that it's currently delivering a standard of care that patients should be satisfied with. Patients know it's not true, and NHS staff know it's not true. Labour will give the NHS the investment and staff it needs, but that has to result in better standards for patients. And that challenge is not only aimed at the BMA, by the way. I thought it was extraordinary when Jeremy Hunt announced the funding settlement for the NHS in the autumn statement with not a single word on what the money would deliver for patients or a single reform of the health service alongside it. Instead, he turned to a former Labour Health Secretary to provide the answers. And who can blame him? As the last Labour government showed, it is only investment plus reform that gets results. I read today that Rishi Sunak has realised the NHS does need reforming, although he has yet to come up with any new ideas about what that should look like. And I'm afraid it is just not credible to try and start this conversation after 12 wasted years. Where the BMA has proposed solutions, like on doctors' pensions, we are working with them and pushing the government to act. It is wrong that perverse pension rules are pushing doctors into early retirement at a time when patients need them more than ever. I get that retention is as big an issue as recruitment, and that starts with fixing doctors' pensions and keeping those who want to stay in the NHS. In my interview with the Sunday Telegraph last weekend, I was quoted saying the NHS must reform or die. A few extremely online bad faith actors have taken those words to suggest I am ambivalent about which my preferred option would be. I do believe the crisis is existential for the NHS, and it is in defence of the NHS's founding principles, funded through progressive taxation, free at the point of use, that I make the reform argument. Even if we weren't in the midst of the biggest crisis in the NHS's history, the NHS would need to change to keep pace with the times, with our ageing population, and the extraordinary advances we are seeing in medical science and technology. But it is because the Conservatives have crashed the economy and left the public finances in such a mess that reform must do even more of the heavy lifting. And it is because of the remarkable breakthroughs in medical technology here on this island that I believe that Britain can lead a revolution in medical science which transforms patients' care. And it is because of a workforce that is incredibly talented, dedicated and hardworking, but too few in number, that we will train a new generation of NHS staff so that the health service has the doctors, nurses and midwives it needs to treat patients on time again. Thank you very much.
Thank you very much. And if I just ask anyone who's coming in online, please to stick their electronic hand up so we can get early sight of your intended question. Just trying to have a look around the room just to get a flavour of how many people who's wanting to ask questions. Lady in the second row from the back there. Second row from the back, other side.
No,
Lady,
thank you.
Name and organisation, please.
So hi, I'm Lucy, and I'm a journalist from The Spectator. But I'm also a doctor, and I graduated from medical school just in July, just there. I'm really interested in this, obviously, for very obvious reasons. But I suppose from my time in medical school, what I found was as much as people, we need more medical school places, but there's a big retention issue in the NHS. And I know I've obviously not gone on to work in the NHS. I'm not a practicing doctor just now. And a lot of my colleagues and classmates are planning, as soon as they finish their Foundation 2 programme, to go to Australia, to go to the US. And I think there's a massive retention issue at the other side of medical school. So I suppose what my question to you would be is, as much as we want to sort of bring in more medical students, how do we ensure we keep them in the UK and don't fund doctors for other countries?
Yeah, do you want me to take them one by one?
Yeah, why don't you do
That's a great question. I mean, and some of this is a bit chicken and egg, isn't it? Because on the visits I've done recently to medical schools and talking to students on their clinical placements in hospitals, one of the things I'm really struck by is the things we read about in the newspapers and hear from staff who've been in the profession for years is, in terms of the burnout, in terms of the conditions they're working in, the exhaustion they feel, the sense of moral, the sense of moral injury they feel at the end of a very long day when they've done their best but feel that the conditions mean it still wasn't good enough for the patients. Students are experiencing that too. And on a visit to Chester Medical School, talking to a bunch of nursing and midwifery students, ranging from their first to fourth year, I asked them how many of them had directly experienced burnout, and every single one put their hand up. So that tells us about the conditions that people are working in. And we can't afford for people to fall at the first hurdle and decide at the end of their training they're just going to go somewhere else, whether that's another profession in this country or another health system elsewhere. I think there are a number of things we're looking at and thinking about in terms of retention and ways in which we can incentivise students to stay working in the NHS here in England, specifically the UK more generally, once they finish their courses. I think there's a whole bunch of people we've lost from the NHS in recent years who I think could be inspired to return if they feel there's a sense of light at the end of the tunnel. I talked about some of the practical things we can do on retention, like fixing the doctors' pensions issue to stop people leaving prematurely. But I hope that our plan, most ambitious expansion of staff in NHS history, might reassure some of those staff who are in the system now or who have left the NHS because they couldn't see light at the end of the tunnel to potentially either stay or return. And, I think certainly over the course of the next year, we'll have more to say, not just on recruitment, but on retention and return. Because I think it's those three things together that we will need to plug the workforce gap and to make sure that staff who are currently in the NHS and people who are considering a career in the NHS can see some light at the end of the tunnel and feel a sense of hope and possibility, and I hope in the end achievement, that they were part of taking the NHS from its worst crisis in history to an NHS that is genuinely the envy of the world again.
Thank you. I'm just trying to see who's lady here towards the front. Name and organisation, please.
Thank you. Wes Latika Burke from the Sydney Morning Herald. In some countries, public and private healthcare systems sit along each other quite well and with a lot of public support. So my question for you is private, and I'm not saying privatisation, is private a dirty word for a Labor government?
Well, I'm glad you drew the distinction between private and privatisation, because the internet really struggles with that. I think that certainly for us, and we're drawing on experience here, one of the ways in which the last Labour government delivered the shortest waiting times and the highest patient satisfaction in history was using the private sector in a smart way to bring down NHS waiting lists. And this, for me, is both a pragmatic and a principle point, right? So when we've got a backlog as large as it is now, pragmatically, we cannot afford to waste a single bit of capacity that exists in healthcare in this country. And I think people want to be seen faster. As long as they're being seen by someone qualified, as long as they get the treatment they need in a safe environment, I think people just want to be seen. And whether that's in an NHS setting or a private setting, so long as they're not paying for it, as long as they're not hit with a bill, I think people want us to get them seen as quick as possible. That's the pragmatic argument. For me, the principled argument is this. In our country today, we have a two-tier healthcare system to a greater degree than I think we ever have. And that means that people who can afford to pay to go private do and get seen faster, and their outcomes will be better. And those who can't afford are left behind. From a principled centre-left perspective, I just find that unconscionable. The idea that people who've got money, or I'm afraid in some cases as well, people who are scrimping and scraping and getting themselves into debt, I find it unconscionable that those people get seen faster and people who are too poor to pay get left behind. So there's an equitable principle here that we're thinking about. In the long term, I want to reduce the reliance on the private sector, as the last Labour government did. In fact, by the time we left office, use of the private sector had fallen off a cliff because the NHS was so good that people no longer felt they had to pay to go private, which is obviously where I want to be as a Labour politician. But to use the private sector capacity in a way that gets people seen faster is both a pragmatic and principled thing to do, and something we're absolutely committed to.
Thank you. Just trying to see again. Gentleman at the front there, towards the front. He had his hand up patiently. Name and organisation, please.
Thanks very much. Hi, Wes. Sean Walsh from Cancer Research UK. Lots to agree on in what you've outlined. I was particularly interested in your reflections at the end about Britain leading a revolution in medical science, and would welcome a little bit more reflection on that, because one of the real challenges we have with the NHS is that staff simply don't have enough time to make research part of their work, and yet there's a rich opportunity there to do that. So I wondered if you had any reflections on that, and if you don't, I'm happy to send you a report that Cancer Research UK has done that shares how we think we could better embed research within the NHS.
Well, the first thing to say is, if you do have anything for me to read, this is the ideal time, because Christmas recess is one of those moments where I get through my reading list in a way I might struggle to day to day. But reflections on where we are in terms of medical science and technology. I mean, we're already, I think, in lots of respects, well placed as a country, whether that's in terms of life sciences, technology, data, to really revolutionise the way we do care in this country. So I've talked about my frustrations with the NHS as it is today, late diagnosis leading to more expensive and less effective treatment, and the need to do earlier diagnosis, which will mean faster treatment, better outcomes, and better value for the taxpayer. But with what we're seeing now in terms of genomics, I mean, in your area specifically, what we can do now in terms of precision medicine and really personalised cancer treatment, I mean, this will be revolutionary, not just in terms of more precise treatment with better outcomes, but potentially being able to predict and prevent illness. And that would be truly revolutionary for the NHS and truly revolutionary for an ageing society, where ultimately we want to not just live longer, but live well for longer. I don't think that we are good enough in Britain yet at adoption and rollout of technology that already exists. You may have read last weekend, I was waiting for my cancer follow-up scan, and one of the reasons for that is that government's ramped up the diagnostic hubs, but ultimately there's the same number of people there going through the scans. Well, we already have technology that exists that would enable us to go through scans a lot faster, so we should be using it. There are plenty of other examples of treatments, technologies that already exist that we're not making enough of. And on data, I think the government needs to tread carefully, because we've got a closed system with tens of millions of people in it, a diverse population, that offers enormous opportunity for research, but also for far more personalised advice and treatment. And I think the government's got to tread carefully before balkanising the system and having lots of regional data platforms, but not necessarily a good smart national data system. So I think there are lots of we get into the weeds of policy on some of this stuff, but that's exactly where we need to be, working through some of the practical details. Because I think if we can harness the benefits that already exist, if we can make sure the UK is at the forefront of the technological and scientific revolution in relation to life sciences and technology, then we can transform patient outcomes and get better value for money. Because that's the final thing I'd just say on this, is that when I talk about this, some people say, well, yes, that might help you deal with some chronic disease, it might help you deliver better outcomes, and there might be some savings there. But as technology improves, as we get new breakthroughs in drugs, those things are expensive. But I think that fails to understand the fact that in some areas prices are coming down pretty rapidly as take-up of technology widens. But on pharmaceuticals in particular, breakthroughs in AI and machine learning mean that the pharmaceutical industry will be able to save a hell of a lot of time and resource, narrowing down at trial stage the drugs that they're developing, which will save a huge amount of time and cost, and potentially means cheaper drugs too. And we've got to think about all of this coherently, which is one of the reasons why in recent months with Jonathan Reynolds, our Shadow Business Secretary, I've probably had as many meetings with industry leaders in life sciences and technology as I have with NHS and social care leaders, because I think this agenda on science and technology is absolutely mission critical to creating an NHS that's fit for the future.
Gentleman there, towards the front, by the aisle, with the pencil. Yeah.
Hi, Wes.
Paul Lehman. Organisation, please.
Yeah, Paul Lehman from Spire Healthcare. Was very interested to hear and encouraged by your comments on the use of the independent sector to help with spare capacity, and we also stand ready to provide placements for doctors in training as we did during the pandemic. Just interested to know your thoughts on the Elective Recovery Task Force that was launched last week. What do you think? What are your expectations of it, and what would you like to see it do?
Can I just ask, because I think time, because of limits of time, there's another gentleman there. We take them as a clutch, just in front of you.
Ian Watson from BBC. I had two questions actually, one in the future and one in the here and now. In terms of the future, from your own experience as an NHS patient, what do you think needs to change about the culture of the NHS, not the resources, but the culture? When you talk about reform, what are the kind of reforms that you would consider that would surprise people if a Labour government did them? On the here and now, of course, talk about diffusing NHS strikes by getting around the table. Can we be more specific? Some Conservative MPs are saying it's time to revisit the peer review body recommendations. Do you agree with them, and do you think those peer review bodies themselves need to be reformed?
Yeah, they're great questions. I mean, Paul's question first on the Elective Recovery Task Force. I mean, the thing I want from it fundamentally is smart ideas at pace to deal with the backlog. I mean, we called on the government to do something very much like this months and months ago, and I think this is one of those examples where the churn in personnel and the chaos at the heart of the government in terms of secretaries of state, ministers of state, and so on, I think has really hampered the NHS's efforts and kind of bred uncertainty in the system, which has not helped. I think, thinking back to vaccines, which is the thing that the government point to as, one of their big successes in terms of the vaccine rollout. Well, why was that successful? Well, I think largely because lots of people who weren't in the government were responsible for it, and they got in some outside experts to really drive the agenda in a way that I think took the entire system with them. There was a sense of real mission and focus that was driven by serious people. And I think even well, in fact, you know, in some ways, even die-hard Conservative supporters, I think, are among some of the most angry about the way in which the government's behaved and the way in which people have not taken their jobs seriously, because I think they expect better of their own party. And I think they can see the consequences of not having serious people focused on doing a serious job in government. So I hope that we can take the sort of the best of the approach of the vaccine rollout in terms of getting in some serious outside experts and providing a real sense of focus and mission to the system that gives staff the confidence to know they're working to serious people with a serious plan. Ian, you've got a great series of questions there. On pay review body, I think that might have been an idea to sort of go back to the pay review body for a fresh set of recommendations, perhaps when the RCN first balloted for strike action in the summer. I don't understand why it took so long for the government to engage seriously with the RCN's concerns. They had not balloted for more than 100 years of their history, let alone gone on strike. I think the challenge now is that some of the health unions involved in the pay conversation, like GMB, are not engaging with the pay review body. I think at this late stage, the fastest, most effective thing the government could do would be to engage in direct face-to-face negotiations with the Royal College of Nursing, Unison and others on pay. That would immediately suspend strike action, as the unions have promised to do. And honestly, what's the worst thing that can happen? Worst case scenario, the talks break down and there's no agreement, but at least everyone can say we've tried. I don't understand how we got to a point this week where we've had strikes with all of the disruption that we saw yesterday without a single minute of negotiation having taken place. When the bar for those negotiations was set so low, it was surely the easiest thing in the world to say yes, which is why I've been quite cynical about the government's motivations, and I think they would like to cynically say, well, the reason the NHS is having such a bad winter is because of these strikes, rather than the challenges that have been 12 years in the making. So I don't think there's any substitute now at this late hour for direct face-to-face negotiations on the issue of pay to see if a resolution can be reached. On culture, because I think the surprise in some ways is, we've been quite firm about where we are on use of the private sector to bring down NHS waiting lists, but perhaps the other surprise is on culture in a way. We do have a culture in the NHS where I think too often patients aren't listened to, and we're seeing that particularly in relation to women's health and the ongoing issues we see raised in relation to things like endometriosis, polycystic ovary syndrome, menopause, conditions which are widely experienced by women in the case of PCOS and endometriosis, universally experienced in the case of menopause, and yet we still have a system that doesn't listen well enough to women when they're talking about their health, which means poorer diagnosis, miserable experience, and poorer outcomes. And I think that's been well evidenced now over a series of reports. And it shows that even where a system is staffed by people who really care about their patients, the culture doesn't always lead to patients being listened to. And so that's one of many reasons why patient voice is really important to me. The second thing, reflecting on my own experience, because unsurprisingly I've not had to grapple with PCOS or endometriosis or menopause except in relation to members of my own family and hearing from them about their experiences. I saw during my experience with cancer last year something I never thought I would experience in the NHS, which is when I went in for my kind of pre-op stage before I had my, I should probably have said for context, but I feel like I bang on about it so often that people know, but I had kidney cancer last year and I was successfully treated, so I'm very happy talking about it. And I went in for my sort of pre-op and I had to have blood tests, swabs, COVID tests, pre-op drinks, kind of the pre-op assessment and conversation. So I had a whole range of tasks that needed doing. And the clinical nurse specialist I was dealing with said, do you know what? You've got to come for all these things. We're going to do it all in one morning and we're going to structure the morning. So you'll have to be here for a few hours, but we'll get everything done. So you only have to come in once. And I was blown away. I was like, wow, I've never experienced this in the NHS. They've really thought about my convenience as a patient and not having to schlep in and out of the hospital all the time, especially as I was going to the Royal Free and travelling around the A406. And then I realised the reason that the NHS was doing it in that way was as part of the COVID measures and reducing patient footfall into the hospital, which was, of course, entirely appropriate thing to do. But it proved to me, if they could give me a better experience as a patient and make things more convenient for me from a safety point of view in relation to COVID measures, we can do that for patient convenience too. And I do think there is sometimes a bit of a culture, going back to your point in the NHS, where patients have to do things at the convenience of the NHS rather than at the convenience of patients. Now, when I say things like this, and I can already feel the groans of people who are currently working in the NHS saying, hang on a minute, on top of all the misery we're going through and the workload and the backlog and everything else, he basically now wants things at his convenience. This is really unreasonable. So I just sort of underline the point by saying, I don't expect that we'll be able to wave a Labour magic wand and fix all these things on day one of a Labour government, but it's a totally reasonable thing to expect higher standards and patient convenience to be at the heart of what a modern healthcare system would look like. And I know it will take time to get there, but we've got to have that ambition, and we've got to have patients first and foremost in our minds when we think about the kind of healthcare system we design and the way that the NHS works and responds to patients. And perhaps people might find that as a surprise, because sometimes the party of the NHS can sometimes be the party of the voice of the people who work in the NHS. And this would be my sort of concluding point, really, on your question. The NHS exists for patients. We've got to be there for patients first and foremost. I work for patients. I've got to be the patient voice, the patient champion. Every other part of the NHS is well represented by Royal Colleges, by unions, by NHS providers, NHS Confederation. There's a whole swathe of organisations, but it's the patient organisations and the patient voice that is least resource and often the quietest voice in the room. So it's my job to be the patient's voice. And the only way in which we'll be able to deliver for patients is working with the profession by making sure we've got the best possible staff, well-resourced, well-supported, well-motivated. So I know we can't do it without the staff, but sometimes I think particularly when the system's under pressure as it is, we have to remind everyone that fundamentally we're there for patients.
Thank you. Gentleman there, yes, third row from the back on the right side as I look at it. Yeah, there. Name and organisation, please.
Carl Dinnan, ITV News. Bringing you back to the strikes, Wes, which you did mention in your speech. As I understand it, and you'll correct me if I'm wrong, your position is that you can't say how much a Labour government would offer NHS workers because you don't have access to all the accounts and all the books. Does that mean that it is possible, from your point of view, that maybe the pay review bodies have got it right? Or is the fact that the nurses are willing to strike, by definition, a sign that they've got it wrong? And do you think that the nurses should be getting more, even if you can't put a figure on it? And allied to that, is the pay review body system working, or does it need to be changed?
Well, I think we've got to bear in mind that when the pay review body made its recommendation, inflation wasn't running as high as it is now. And I think we are in an extraordinary year where the actions of the government have made inflation so much worse, which means staff are now feeling even greater pressure in their pockets. And I think that, coupled with the conditions they're working in, have forced nurses to breaking point. And the fact they've got a government that isn't willing to even sit around the table with them, I think has added insult to injury. And we often say and hear that strikes are the last resort. I think I can safely say on behalf of every nurse in the land that when they voted for strike action, they really considered it as a last resort. And I think many of them in their heart of hearts had hoped and believed that they would never be on strike because the government would have intervened and listened to what was effectively a cry for help from the nursing profession. I've been honest about the fact that if Labour were in government today, we wouldn't be able to offer inflation plus 5%, but we would be willing to negotiate. And I think that honesty is important. The other thing we are really mindful about in the Labour Party is we're so anxious not to make promises we can't keep. And it's because I don't know what the public finances will look like in 2 years' time, what inflation will look like in 2 years' time, what the pay settlement will look like in 2 weeks' time, let alone 2 years' time, that I'm not going to make a commitment today about precisely where Labour would set pay. But I do understand why the nurses feel the way they do. And I think it is the most reasonable request in the world to say to a government, we'll suspend our strike action if you're just prepared to sit down and talk and seriously negotiate on pay. And I cannot understand why such a reasonable request has been met with a stony wall of silence from the Health Secretary. And the scenes we saw yesterday I just thought were heartbreaking. I thought in what has been a year of so many lows for this government, the sight of nurses on picket lines was a real low. And what's more, the sight of nurses in Bristol breaking their own picket line to rush to the aid of a man who'd fallen outside the hospital really does show us who we are dealing with when it comes to nurses. They are people who care deeply about their patients, love their jobs, but are absolutely desperate for a government that understands the pressures they're under and the pain they're feeling in their pockets and their wallets. And I think a Labour government would understand that, and that's why in the 13 years we were in government, we never saw nurses going on strike in the way that we saw yesterday. Thank you.
Sorry, the pay review bodies, is that system?
I think the unions, I think, have expressed some concerns about how the pay review body works, and we've said we would be willing to look at those concerns as part of a wider negotiation to avoid strike action, and I think the government should take up that challenge.
Group of questions online. I see David Goodhart from Policy Exchange, Malcolm Reed of the Medical Schools Council, and Sandra Nicholson of the University of Worcester. David, do you want to go first?
Yes. Can you hear me?
Yep.
Yeah, loud and clear.
That's good. Thanks, Wes. I'm very glad that you've taken up the issue of raising the training places for doctors. I mean, it's basically common sense, isn't it? And I was very glad to hear you imply that sucking in immigrant doctors from poorer countries is morally repugnant. But, I mean, aside from the party political knockabout, your prescription for the NHS, basically more prevention, more community-based care, better use of technology, is very, very familiar. I mean, it's basically shared by everybody, certainly including Jeremy Hunt, but it's not really happened, or it's not really happened enough. Why do you think that? Do you have an understanding of why that is? Is it just money? Is it that it's too producer-dominated? Is it that it's just too damn big and centralised? And why should we think that you will succeed where other people have failed?
Malcolm Reed, Medical Schools Council. Can you hear me, Malcolm? Can you hear me? You still there?
Yes, I can hear you. Can you hear me?
Yeah.
Yeah, great. So my name is Malcolm Reed. I'm Dean of the Medical School at Brighton, which is one of the 20-year-old medical schools funded by the Labour government. And until August, I was chair of Medical Schools Council. I'm still on the council. I just wanted to make a statement almost that medical schools and universities would be entirely behind this plan and are starting to think and plan about how they would deal with this expansion. They're fully committed to broadening participation in medicine as undergraduate courses and for our graduates, and share all the concerns that have been raised. My only question would be about the fact that some aspects of this are devolved to the 4 nations, and just to ensure that all 4 nations would be on board, because educating medical students is a UK-wide endeavour, as is the foundation programme that they go into. So just wanted to ask about that.
Very good. Sandra Nicholson, University of Worcester. Can you hear me?
Can you hear me?
Yeah, please go ahead.
Lovely, thank you. From the University of Worcester. So we are currently anticipating funding to take home students. We would be one of the new medical schools. One of the reasons why we are waiting, we have been told, is because of the placement capacity. So I'm intrigued to know what your plan would be to increase placements, because not just do we not need more placements to train students and other healthcare workers, but they have to be good placements of high quality too. Would you like to expand on that, please? Thank you.
Just one for the road. Elizabeth from British Medical Journal has had her hand up patiently. Elizabeth, can you hear me?
Yes, can you hear me?
Yeah, loud and clear. Thank you.
Brilliant. Sorry, yes, Elizabeth Mahays, British Medical Journal. It's on a similar vein to the last question on placements, but obviously once doctors graduate medical school, there are a lot of issues with ensuring that they have training places for foundation training, etc. If you're increasing medical school places, how will you ensure there are enough training places for once they've graduated? And, you know, dare I say, while also improving working conditions for junior doctors?
Yeah, these are really great questions. Let me take them in order. David, I think well, the first reassurance I can give you is I absolutely recognise what you say, and I spend a lot of time as Shadow Health Secretary asking why. Because lots of the things that I talk about in terms of prevention and technology, early intervention, these are things you will find in every NHS 5-year forward plan, and they are the things that are so rarely delivered to the standard that we need. I think part of it is about, you know, in a crisis situation as we are today, I think the NHS has become even more short-termist than it has been over the last decade, and that really worries me. And I think part of my job as a Secretary of State will be to challenge the NHS board and the NHS England leadership to set their sights longer term and to make sure that they are kind of, you know, thinking a lot more about the sort of the 5 to 10 year horizon, the 20-year horizon, than the winter horizon. And I'm struck by the fact when I speak to people around the NHS leadership, that the conversation often goes straight to the immediate and the urgent, and you can understand why that is. But I think it's the job of national leadership in particular to help the system think and plan for the long term. And unless we do that, we will just end up in this kind of, you know, the doom spiral that Rachel Reeves described on the economy will similarly become a doom spiral for the NHS. I think this government has lacked mission and focus, and it's one of the things I've sort of been challenging my team around is, you know, we cannot do everything for everyone all at once. So what are our really core key priorities, and how will we make sure that we're ready to deliver? And I'm very happy to have lent Patricia Hewitt to the government to advise them on a specific challenge around the ICS, but I'm really blessed with a wealth of knowledge and experience and expertise in the form of former Labour Health Secretaries who've been there, done it, got the results. So I draw heavily on what will hopefully be my Labour predecessors, so that we can make sure that we really deliver what we say. And it brings me to the final point about promises as well. I did an LBC phone-in the other day, and during the course of the phone-in, had some really great suggestions from people calling in, particularly patients wanting free hospital car parking charges. Well, having been rinsed in my car parking charges last year, I've got a lot of sympathy for that. I had a student who was raising the issues that she's experiencing around financial hardship, especially later in her medical training, and I've got total sympathy for that. I wish I could have said on the phone there and then, I'm going to scrap all hospital car parking charges and I'm going to increase student grants and student loans. But unless and until I know that a Labour government will be able to afford and deliver those things, we're not going to make promises we can't keep. So I think being focused, being really clear about what we can deliver in the first term of a Labour government, and having a really clear 10-year plan for change and modernisation is how we will make sure we deliver what we say we will. And it's that learning that fundamental lesson from the last Labour government, that it is investment and reform that delivers results. I think that's what will bode well for the next Labour government. Malcolm's question particularly, I really welcome the support I've had from the Medical Schools Council and the conversations I've been having with university vice-chancellors and deans of medical schools, and I'm really excited that people are already thinking about how they will deliver. On devolved nations, I can say confidently that the Welsh Labour government are delighted that we are placing such a great emphasis on recruitment, and of course our costings for our policy build in Barnet consequential, so there will be a benefit for devolved governments. I think even Nicola Sturgeon, in her heart of hearts, though she dare not say it publicly, knows that the best thing for Scotland after the next general election will be a Labour government in Westminster, and that people in Scotland can choose to oppose the Conservatives with the SNP, or they can choose to replace them with Labour. And I think we can see which way the wind is blowing in Scotland, which is why the new leader of the SNP in Westminster uses so much airtime in his questions attacking the Labour Party. Politics aside, back to the delivery. Sandra, your question on placement capacity. I think this is where returners could make a really big impact. People who've left the NHS in recent years, not seeing the light at the end of the tunnel. I think if we said to those people, who I think, pensions aside, have largely been driven out by the conditions they're working in, and not seeing any light at the end of the tunnel, and not seeing the cavalry coming, and reading that we're cutting medical school places, I think saying to those people, we'd like you to come back and help us fix the problem. How would you like to train the next generation who are going to save the NHS? I think would be a really compelling moral argument and mission that people would want to step up to. We need to think about how we incentivise that and make that real in a practical sense. But I would see returners as playing a big role in medical education, because we are, as well as losing people and staff numbers, we're losing so much expertise. And, you know, anyone will tell you in medicine, and it's true for all of us, I think, in our careers, but particularly in medicine, you know, you build up so much knowledge and expertise over the course of your career. People are much better doctors after years of clinical practice than they are when they're fresh out of medical school. So bringing those people back to impart that knowledge and wisdom and to be part of building a better future, I think would be a really great way of both inspiring a new generation, but also allowing those people who've left probably feeling pretty miserable about how their career in the NHS ended, giving them a sense of closure and a sense of fulfilment that their career was well spent and that they played a really great role right to their last days in the NHS. And Elizabeth, I think that kind of speaks to your question as well about placements and how we can give people a better experience. But I'm determined to do more medical school visits over the next year, really talking to students about their experiences. I don't want people starting their career in the NHS feeling battered. I want them to start their career in the NHS feeling inspired, but we're a long way from that now, and I want to think practically about what we can do to improve the student experience so that people who are starting out their career in the NHS see that as a career for the long term, not just to get the training before they go elsewhere.
Brilliant, thank you. And I'm afraid that's going to be all. We've already substantially exceeded our allotted time for good reason, because it's an outstanding paper by Sean Phillips and Ian Mansfield. Delighted that Wes Streeting here to join. It's been an outstanding audience. My apologies to anyone we weren't able to call upon. If you submit your questions, we'll, of course, needless to say, be glad to pass them on, but all that remains is to us to thank our guest of honour today for his part on this hugely important subject, and say look forward to further dialogue.
Thank you.